This video is part of the Massage Therapy Clinic lab notes for Stark State College. The instructor is Michael Vahila, licensed acupuncturist and licensed massage therapist. Okay, so we begin as always by applying lubricant to the entire limb. And you notice again that I'm bending at the knee. You can do what Kellogg would describe as more of a rotary stroke, if you like. But notice that the wrists are straight, relatively straight. So then we come down to the foot and we do kneading of the entire foot. This is similar to what we did on the hand. Here there's enough size that we don't really have to do any of that sloppy sliding thing. You can really just compress here. And as I'm doing this, I'm also tractioning just a bit. And when you do the kneading on the toes, it's similar to the fingers, but instead of the coin shuffling effect, just grasp and traction a little bit. Toes can be a little more ticklish. There's not as much room between them. So I'm really just compressing and tractioning for the toes. And then frictioning on the top of the feet, again, you want your thumbs between the metatarsals and gliding through each set of metatarsals. If you can't feel clearly where they are, then just guesstimate. On some feet it's not clear exactly where those are. As you go to the sole of the foot, you're going to support with this hand, and you're going to use your knuckles and glide under the sole of the foot. You're supporting the foot, and you're making a fist, and you're just rolling your hand through the entire sole of the foot, like that. You can use firm pressure, but don't overdo it here, because you are using your knuckles. Then you can come around to the side, and you're going to do digital kneading around the ankle. So you're taking the pads of 2 fingers on either side of the ankle and digital kneading. Then one application of the rolling technique in Kellogg is to lock the heels of your hand under the ankles and just go back and forth like that. You're not trying to create a rolling motion, you're just really going straight, but it'll look like basically a foot wobble. So that finishes the foot, so then you tile that in and friction the entire leg. Now, kneading on the calf, we're going to do Palmar kneading. And I want to point out that we're mainly trying to treat this lateral aspect, the tibialis anterior and the extensors of the toes. So most of the pressure is on this hand. This is just kind of going along for the ride. Then for our friction here, I'm going to use my knuckles. So most of the pressure is on these 2 knuckles. This hand, however, glides behind it. So many times when we use knuckles, we'll have another hand behind it to kind of soften the intensity. So a couple strokes and then move lateral, and a couple strokes and move lateral. Okay, so that's the leg. And then we're going to friction the entire leg. And now we're at the knee for digital kneading. Again, 2 or 3 fingertips. Just about 3 little circular strokes, move to the next area, 3 little circular strokes, the next area. Then we're going to do a type of friction called spreading, where I'm using the side of the thenar eminence, below the knee, on the knee, and above the knee. And this again is fairly firm pressure. Is that pressure okay?
It is until you do on.
On the knee, okay. And then there, and that's it for the knee. You're gonna wanna come around here. Now we're doing the lateral thigh. So the iliotibial band, we're gonna glide like this. So notice I'm bending my knee. I'm also supporting my elbow on my hip. Now that may or may not work for you. But I just want you to get a sense of that stroke. Also, I tend to pulse this a little bit, meaning I don't just use static pressure, but it's almost more like I'm doing this as I'm sliding. So it just creates a little bit of a rocking effect as you do that. Now our target tissue is the quadriceps. So here we are doing alternate one-handed petrissage. As I said, this, you don't want to slide when you do petrissage. I'm purposely being a little careful here, but when you do it faster, not that it has to be real fast, after you've compressed, it'll look like the hand is sliding, but it's really just that it's being positioned for the next compression. So it's compress, compress, compress. The slide that you see happens after I topped out at that compression. I'm not sliding in the stroke. Then we'll take the quadriceps group, divide it into 3 segments. So there's the vastus lateralis, vastus intermedius, and vastus medialis. And using the knuckles, again, a nice straight wrist with the open hand behind it, just like we did in the forearm, but now this is much larger area of tissue, so we're using a much broader, stronger area of our body to treat it. So we're using the fist, but it is followed up with the hand. And then the medial thigh, again, alternating one-handed petrissage. So just like we did on the forearm, you grasp, lift, grasp, lift, grasp, lift. So usually going a couple times through the adductors. And then this time the deep friction strokes will be done with the heel of the hand, gliding up and laterally as you come out. So then you friction the entire leg. And with Palmar stroking. And then just a little traction at the end where I'm just gently tractioning, but don't hyperextend the knee. Do not do that. Just a gentle traction for the entire leg.